Welcome everyone to another wonderful episode here at Doctors of Podiatry. Young patient presents to our office today with a very atypical ingrown toenail, left great toe. Patient is an avid volleyball player, collegiate, and is here visiting her family, which is quite important, to say the least. So without further ado, Caesar, let's take a look. Okay, so what we're gonna go ahead and do is just work this proximal nail fold like this. Everyone can see we have a cocoon-like lesion. It's actually a hard callus. There might be a pyogenic granuloma underneath, and we're gonna obviously remove this as well. This has been, the body has created this cocoon as a result of the offending nail plate. Protective mechanism. Okay. So, and the nail is quite dystrophic. Sorry about that, Caesar. Just kind of slowly working it like this. The nail is quite dystrophic because of the volleyball. So we're going to start here, do this, like that. This is very, very thick. Just try to pick it up. You see it's all, before I take it off, this is all attached. You see that? We'll kind of grab it like this, and then everything's gonna basically just come out all at once. You see that? So what's interesting, put this down here. Little piece of connective tissue there. Okay, everyone. So this is something a little bit different, right? So we removed the tourniquet. That's why we see a little bit of blood. But I'm gonna dab here. So what we decided to do is bring the fluoroscope, live X-ray, into the room here, and as everyone can see, right around here, there's this white tissue. So I automatically decided to finish the procedure and then bring in the X-ray, the fluoroscope. So let's take a look here. So we have seen this patient before, at the time several months ago. No signs of this here, clinically. So I would say in the last couple of months, this has probably developed into either a cartilaginous or a bony deformity. And we'll just call it that.
No, you probably do.
No, there is, yes, it looks like a second piece of bone is growing out of the distal phalanx. And yes, that is the case. So what we're gonna go ahead and do now with the patient is talk about, some of our options here, okay? So this is quite different. The offending nail plate is removed. I think this is not only the offending nail plate, obviously we have found a deformity, underlying deformity that might be affecting the clinical presentation. Okay, so we're gonna put another stop on this and then we'll talk a little bit more at the end, okay? Okay everyone, so what we're gonna go ahead and do is we're gonna take the patient later this week to surgery. So in respect to the findings, right, the clinical findings, we went in with a routine partial nail avulsion of the offending nail plate. And in the last couple of months, apparently the patient developed a possible bone neoplasm. It's a benign tumor until proven otherwise, also known as a possible osteochondroma. O-S-T-E-O, osteo, bone, chondroma from cartilage. So, the goal is, in cases as such, in my opinion, I think that if something is causing functional discomfort, pain, that's a clear-cut indication to remove the problem. This patient is young, active, volleyball player, and looking at the x-rays, it seems that there's a possibility that the growth can continue to grow. So we want to make sure we address the problem already. Also, as everyone saw in the video, I'm sure that Caesar was able to capture that, we're able to actually visualize the lesion that's it wants to kind of perforate into the nail bed. I've seen cases as such where that this patient had it on the side, but when it's actually through the nail bed underneath the nail, it can actually break through the skin, and that could be problematic for a lot of obvious reasons. So what we're going to go ahead and do is, this is just kind of like an update. Later this week, we'll go ahead and do another video of the surgery itself. That's something that I think that a lot of people will appreciate and enjoy, right? We're going to be able to show the actual surgery. It's going to be an open traditional surgery. It's not going to be something percutaneous or minimally invasive. We're going to go ahead and open the toe and excise the mass, the lesion, the tumor, to make sure that we send it for what we call histopathology analysis. Send it to the lab to make sure that it is what it is and nothing else. Caesar, anything else? I know I spoke a little bit more so than the usual here, but I think it's really important for everyone to understand that, of course, we went in for a very routine procedure. We found this, and now we're addressing the problem to treat the problem accordingly. Sounds good? Good. So as always, we will continue to do what we do, educate the world, 1 foot and 1 toe at a time. I'll see you guys in surgery. Have a nice day.